Hello, y'all. Thanks for your time. My name is Dr. Stephen LeBoeuf. I'm one of the founders and also the president of Valencell. And I put this presentation together for y'all because, Valencell, we're an interesting company. We make core sensor technology that goes in wearables. We don't make the wearables ourselves. So we get a lot of inbounds into our company from companies that want to make fitness products, sports products, and now even medical products. And so I put the presentation together to showcase some of the kind of relationships we're seeing being built between traditional, say, consumer wearable companies and medical companies, what we're seeing. Also, I'm going to start with some of the headlines that we're seeing and some of the problems I have with some of the headlines, even some of the headlines that are about products that powered by our technology. Then I'm going to talk about some of the disruption in the space, and then talk about some of the different categories of products we're seeing, kind of narrow them down into 4 categories that we're working on with medical device companies and that other companies similar to us are working on with medical device companies. So let's start with the headlines. So you've probably seen a lot of these headlines before already. These are literally, we just copied the headlines on here. These are the actual headlines of these stories of partnerships between, say, consumer electronics brands and either some kind of health or medical type oriented company. And one of the things is, there's a lot of partnership, a lot of action happening, but one of the different problems is, you got this kind of Roman consumer mentality on the consumer side, slash and burn, glam marketing side, that is mashing up with this Grecian, very methodical, very disciplined medical side. And it's causing some confusion in the marketplace, causing some clashing, including with the headlines. I mean, I'll give you an example of 3. For example, here, one is this story about Huawei and their headphones that have stress tracking in them. Well, that's a product that's powered by our technology. When I saw the headline, what does that mean, stress tracking? I mean, there's all kinds of stress. There's psychosocial stress, there's physical stress, there's cardiorespiratory stress. There's a variety of stress there. And if you're looking at it with a medical hat on, it really doesn't tell you anything. Then there's a story here in TechCrunch. The title, the headline says, Fitbit is teaming up with Dexcom for glucose monitoring on the Ionic smartwatch. Well, if I saw that title, I would think, oh, hallelujah, somebody's figured out how to make non-invasive glucose on a smartwatch. But that's actually not at all what the story's about. It's not nearly that exciting, but it's actually quite useful. What they were doing together is the Fitbit device was being used as a way to view the data much more easily than with the device itself, and also to do some research to kind of correlate some of the biometrics picked up by the smartwatch with maybe correlating it to your glucose changes from the Dexcom device, which is a minimally invasive microneedle patch. It's actually working quite well right now. So, but you look at the headlines there, if anybody with who's been in this field before from the medical side, you see that and it just aggravates you because you think, okay, well, you get excited and you go, oh, okay, it's not what was meant here. And maybe the people who wrote the article didn't even know that that's what it was about. Another one here is with atrial fib, and this story is that AI automatically detects AFib using Apple Watch's heart rate sensor. Now, when I first saw that, I thought about it in terms of detecting an instance of you actually being an atrial fib. There's a difference between saying you're an atrial fib now and you've been in atrial fib sometime in the past hour, whatever the case is, or past day. This is about the latter. It's using machine learning to kind of guess whether or not you've had an episode of atrial fib using low acuity data, which is great, it's useful. But it's not the same as saying, okay, you're in an incident right now. So there's confusion in even the headlines. Now, I see this a lot happening with a lot of stories. At Valencell, we do a lot of AI stuff. We do a lot of direct measuring and a lot of guessing, too, depending on what we're doing. And both are good, but there is a difference, and it's important to understand that in this field. I mean, if I'm measuring your height, I take a ruler up to you or whatever, and I measure what your height is. If I'm using some algorithm or some AI model, I might say, okay, well, looks like a dude, looks American, healthy, 24 years old, born in the late 20th century, looks like Bruno Mars, parents were 71-inch tall, so the guy's probably 71 inches tall. And we know intuitively that the measuring is definitely a better way to do it, to get it down right for certain than estimating, but estimating can be fine too. It's just that, when you see these relationships with medical device companies and wearables, a lot of them are on the estimating side, and that's fine, but it's not necessarily the same as I'm measuring a particular instance right now. So I'm going to talk more now rather than the headlines. I want to talk about some of the disruption we're seeing in the medical space with wearables. And one of the things kind of comes down to cost. I mean, On the left, this is an oversimplification, but on the left is a device that's been around, a system that's been around for quite some time by manufacturer, and it's used for cardiac stress testing. It's used in sports and fitness as well as in rehab. This system is a $10,000 system. And what we know now, there are wrist-worn devices that when you look at all the outputs can do the same thing, where you can get them for $500. Now, they're not used that way today, but in principle, they can be. And so one of the things we're seeing is a lot of functionality coming down to a much lower cost type form factor, which is one of the elements of disruption that we're seeing here in the marketplace. Now, I think this is a good example because it also talks about the overlap between some of the fitness assessments and sports assessments versus some of the medical assessments, where a lot of times what you're doing is you're measuring the same thing but using it very differently. And this is one of the ways we see ourselves working with medical device companies today. A lot of the products we're working on are using established metrics, but using them instead of just for a fitness purpose, using them for a medical purpose. Like, for example, VO2 max. Well, right now that's used in fitness and in sports for performance monitoring and understanding where your overall fitness is at. But in medicine, it's been used for quite a long time in rehab, after you've had a cardiac event, or to see if you can even take a surgery that's about to happen based off a stress test. And so what we're seeing is that the same metric we were using in the fitness case, companies are working with us on how to use that for a medical use case. Another one is heart rate recovery, which, used in sports and fitness, mostly for, where it's found most applicability probably is in endurance training. And it's used in cardiac stress testing, test and rehab, to help you understand, for example, what your mortality rate might be after a cardiac event. And it's used. R interval is another one where, we provide this R interval output. It's used in sports and fitness for doing HRV analysis. You got folks on the wellness side like Heart Math who do a lot of kind of stress analysis there for, I guess, your psychology and what's going on in your mind and relaxation. And then you got folks on the sports side like First Beat who use it for fatigue analysis and a variety of other types of analysis there. But in the medical case, you take this R interval information and you could do assessments of whether or not someone might be in arrhythmia, or they might be in some kind, or even more particularly, they might be in atrial fib or some other cardiac abnormality. So using the same metric but doing different processing on it to do some kind of assessment. So we see these types of relationships happening. And when we boil it down to kind of the areas and categories of products, it kind of boils down into 4 different areas of what we're seeing. The simplest and most straightforward is where the wearable company partnering with the medical device company, it's more of a user interface. This good example is the Dexcom partnership with the Fitbit and Apple devices and some other wearable devices, where those devices are used for you to see the data, view the data, maybe some other things there. And that might seem like an overly simple use case, but you got to understand that can be incredibly useful. I mean, being able to just see how you're doing by turning over your hand. I mean, it's a simple use case, but it is actually very, very useful. And the public health impact is you can view the data, and you can do this now. And we already, been several announcements about that already. When you take it a step up, it's on the health screening side. So some of the products people are working on right now in this space of the consumer wearable side combined with the medical side is sensors that can screen for chronic conditions, that you might have a particular condition. Some of the ones we're seeing right now are pre-diabetic conditions or COPD, or if you might have some cardiac abnormality for screening purposes. A lot of these models use AI in some particular way, but not necessarily. And the big public health impact there is, you could potentially save a lot of money on early diagnosis and prevention. Now, some people believe that model will work and some people don't, but the drive for it really is cost. That's why people are exploring this. Now, these products aren't really ready in the marketplace today, probably in the 1 to 3 year timeline, to where they're really available in a meaningful way. Another one is just replacement of a medical device. So a good example of this is, the Holter monitors that you might have to wear after a cardiac event. Now, with some of the low-profile devices like the iRhythm device, that I believe it's called Zeo, that has everything in this little patch. I mean, that is much higher compliance, much lower cost. Again, the cost factor is there, but you're replacing a medical device. Some of the things that we see happening is a lot of the older ambulatory monitors that weren't really ambulatory, that are really difficult to use, especially for folks who have, say, COPD or extreme cases or exacerbate a lot. We see companies coming to us to find ways to replace those, medical device companies coming to see how to replace those modalities with more consumer wearable type devices. And then, the public health benefit, again, saving costs, lower equipment costs. But this is, again, in the 1 to 3 year timeline before you see any products like this in the marketplace. And then maybe the highest step up is where the wearable is needed for a new solution. Without the wearable, you couldn't do it at all. For example, where we see some folks investing in this space is predicting that you might be about to exacerbate from COPD, or you might be about to have a migraine, or you might about to have a cardiac event of some particular kind. That's one of the things where you need the wearable device and the data that you can get from it, motion tolerant, in order to generate that assessment. And you can't really do that with the sensors in the marketplace today from the medical side for those particular use cases. But also on the therapeutic solution side, I talked about this before, there are companies that are using the wearable device data to help improve even an implantable device. So for example, the wearable device might measure your heart rate and also your R interval to do some kind of heart rate variability analysis and use that information to change a neurostimulator in some particular way. Not acutely, but chronically. So you get the information and you make an assessment, okay, we need to change this parameter in the device that's implantable. I would have never guessed that, a few years ago, I would have never guessed that would be something that companies would be working on, but there really are real use cases for that. It meets the public health benefit there, of course. It meets a completely unmet need and could potentially substantially reduce medical costs, especially like if you can detect the onset of something to get someone to adhere to the medication in a way that will reduce medical costs down the line. So a lot of the motivations really come about from compliance we're seeing in cost reduction. I think the panel before I overheard that same theme on the medical side. The buyer, or the payers rather, don't like paying. And so if you can't find a way to lower the cost, they're really not interested. And that's one of the driving factors. One of the driving factors we've seen is the case, for example, in the medical device replacement, where the preventing hospital visits because of the new penalties that happen when you have to go back to the hospital. That the hospitals, under Obamacare, where the hospitals get penalized if you go back too soon. And that's one of the driving factors for some of these solutions, where the hospitals are looking for solutions to help prevent that. So, when you're looking at these fitness and wearable type companies, and how wearable fitness companies combined with medical grade companies in developing these solutions, I think what you want to look for, the types of companies that are going to do well, are the ones that understand the consumer side well, and that also understand the medical side well. So they understand the Roman mentality of getting out there and getting stuff done, but also the Greek mentality of more discipline on the medical side, and understand both of those worlds. There are a few companies I feel are doing it pretty well. And these companies I feel aren't doing it pretty well, but the ones that are doing it well are getting real traction. And you will really see medical wearables on the horizon. Probably the soonest ones you'll see, the nearer term ones you'll see, are ones where the assessments don't require FDA approval for any particular reason, because you don't have to go through that process. But there are really some really interesting things on the horizon. So thanks for your time.